We're interviewing physicians across rural Minnesota, and as well as other projects. And what we've kind of noticed is that um, now there are areas of northern Minnesota that have kind of these predictors of vulnerability that tend to be higher than the southern half of the state. There's a little bit more issues with access to healthcare in some of the more rural parts. So we're trying to figure out kind of what's that relationship to Alzheimer's. We know the diagnosis rate's a little bit lower up in the north. However, when you look at kind of other elements of this picture, such as emergency room department visits, you'll actually find that rural residents with Alzheimer's and dementia may be using these services versus something like long-term healthcare facilities. And this is really kind of eye-opening because it's really showing the weaknesses in our medical infrastructure in rural areas. And what that means is it requires rural people to kind of have to come in for this care. Now, when you're thinking about something like Alzheimer's and dementia, what that often means is sometimes relocating to receive services. So there are a lot of barriers to allow you to age in place. And that's in part due to the limited infrastructure out in these rural areas. Other than that, there are also some health behaviors kind of associated with Alzheimer's that may be more prevalent in rural areas. There's a little bit more of a drinking culture. I don't want to say that for sure because every rural community is different, right? But there is some research that suggests that rural people may be more willing to engage in unhealthy behaviors. But really, we're still just trying to understand this link between rural and Alzheimer's. What we do know is people who are struggling with the illness, they might not even have a place to stay where they can actually get that help. So that's our big concern right now.